Good afternoon, everyone. Welcome. Welcome. We'll get started in a second. We'll be pulling up our slides, but in the meantime, if you want to introduce yourselves in the chat, please feel free to do so. Your name, your organization, and your preferred pronouns would be great. Next slide, please. So today, as you know, we're here talking about the 2024 election and what is at stake for health equity. This session, a few housekeeping things. This session is being recorded. The meeting links and resources will be emailed to participants and posted to the ITUP website after the meeting. Closed captioning is available. To enable captions, select the CC or the transcript icon from your toolbar. Submit your questions at any time during today's webinar using the Q&A function on your screen. This is the best way for us to stay focused on the conversations and the specific questions. And of course, you can use the chat to encourage you and to engage others throughout today's discussion. But if possible, please use the Q&A for questions for the audience. Next slide, please. So to give you a little bit of a sense of today's call, we're going to start off with welcome and introductions, setting the context for disrupting the path to authoritarianism. So I'll share a few words of why we think this election is so critically important. Will be followed up with an election panel, fireside chat, if you will, and that will include Kieran Savage-Sanguan, from the executive director at CPEN, the California Pan-Ethnic Health Network, Nanette Starr, director of policy and planning at California Consortium of Urban Indian Health, and then Carolyn Wang Kong. She is the president and executive director of the Asian Pacific Fund. Following the panel discussion, we will have reflections and discussion with Raul Macias, Program Director of Democracy at the Evelyn and Walter Haas Jr. Fund. We will be taking questions between the panel and Raul's reactions to the panel. And so, if you want to insert those questions throughout the presentation, please feel free to do so. Next slide, please. So again, hi, I'm Crispin Delgado. I am the executive director at Insure the Uninsured Project. Today, I am wearing my Vote, My Health t-shirt, which I got at the Latino Coalition for a Healthy California event. This is directed by Altamed, one of our community safety net partners down in Los Angeles that's doing amazing work around motivating people to vote. Before I get started into why this election in particular is critically important for the future of all Californians, I want to talk a little bit about ITUP and where we're at. Next slide, please. So one thing that we've always believed in at ITUP in our almost 30-year history is to lift the voices of our community. One thing that makes us unique is that our audiences tend to be multidisciplinary stakeholders. So it could be the CEO of a clinic. It could also be the frontline worker at a clinic. It could be a health plan. It could be state policymakers. And so one thing that we tried to do intentionally is to raise the voice of our communities that we serve. So we convene stakeholders through our health equity collaboratives every year. We do 10 across the state. And based on what we hear, we summarize those notes, we share them with all participants, and then we share a summary with leaders in California that impact what our policies and regulations look like. And we hope to inform future policy as a result of lifting up our community's voices. Next slide, please. And so one of the journeys that we've been on is, when we started in the mid-1990s, it was a time that there was a lot of racist policies that impacted people's ability to access care. Specifically, I think of Proposition 187, which was under the Wilson administration, that sought to prevent immigrants from accessing services like health and education. And, you know, it was urgent for us to become advocates for coverage and explore potential policy solutions to do that. I will say, especially after the implementation of the Affordable Care Act, we've made huge strides in California for coverage. You know, we went from 17, 18% uninsured to today having a little bit over 4% uninsured. That means the job is not completely done yet, but we've gotten a lot closer. And, you know, I think we are prepared to now ask the question, if you have a card, can you actually access care? And what does that care look like? So here at ITUP, we have a vision of what that care should look like. It should be access to equitable care. Equitable care is defined as a diverse health workforce that leverages human and technological resources to provide high quality and effective care to meet patients where they are by identifying and addressing their health and social needs, by diversifying the workforce, fueling data-driven care, and embracing proven technology to improve access. We will see the closing of health outcome disparities. And at the end of the day, that is what matters. As we have this vision of health equities, it's about making sure that everyone that goes into the system, regardless of the color of their skin, that they'll have a fair opportunity at living a long and healthy life. So you see here our three strategic priorities. California's health workforce is diverse and meets the needs of the community they serve. Priority number 2, California's health systems have access to health and social data to drive equitable outcomes. So I like to say what gets measured gets done. So as we try to advance health equity, we need the data to support it. And then lastly, we also want to leverage technology. I mean, we're in California, one of the leaders in technology in the world. So you know, California's workforce leverages technology-based solutions that expand access. So we saw this a lot through our work with trying to expand broadband access to close the digital gap that exists. And we also recognize that with broadband, it improved the access to telehealth and other ways to be able to access providers and your care teams. And this is essential moving forward because we need to meet people where they are. And we know that social determinants plays a key role in that. So if we're able to address the primary social determinant of, say, transportation by providing the tools for people to be able to access their care team at home, I think that that creates more opportunity for them to invest in their health. And then lastly, you know, artificial intelligence. We know that it's already present in our health systems. So, you know, from an equity perspective, how are we making sure that there are policies in place to make to prevent the amplification of pre-existing conditions? If there's poor data in the basic infrastructure of this work, you know, what precautions can we have to make sure that we're not just simply amplifying bias? Next slide, please. And so another key thing that we do besides our conferences is that we also develop ITUP publications. These publications are either meta-focus, giving you an idea of what's happening at the state level. We also do individual toolkits. I think Kuna shared one that she just did on artificial intelligence. And again, we'll share all the links to all these different documents after the call. And then also an overview of California fact sheets. From what I've heard as well, not only do these fact sheets help people understand what's happening at the local level regarding the uninsured, individuals in our network also use these documents as advocacy tools. So they go to their city council or they go to the board of supervisors and share the data that's happening locally. We've also heard that people use these numbers and our data to support their grant applying status. So making sure that they're giving a weight to the problems that they're dealing with. So we appreciate the multiple uses of our documents and our publications. Next slide, please. So setting the context. So 2024 is an essential election. And I know we say that about every election, especially the last 2 or 3 rounds. This one feels exceptionally more important. I think that there is a huge distinction between other elections in the sense that we've reached political extremism. So what used to be Democrats versus Republicans has expanded, and the narrative has expanded a great deal. And so as we explore the different parties that are running for presidential office, we have to consider what is the future in the future of our work, right? So on the one hand, you have one administration whose platform includes dismantling the Affordable Care Act, that includes dismantling the federal government. And, you know, it's profound of the changes that they would like to make in that sphere. On the other hand, you have people that are trying to expand care, the other political party, and protect women's rights, protect GLBT rights. And, you know, part of why we think that having this forum in particular is, one, to gather our stakeholders, to answer questions that might be helpful for you, to share some of the promising practices that our panelists will talk about on how they're engaging their communities and why it's important for all of us to ultimately get out and vote by next Tuesday. I think the consequences of this election are critical, existential even. And I want to remind people that it's not just the president that is being elected in this next election. We also have propositions, of which we'll talk about a little bit as well, that is a way for us as organizations and us as nonprofits to be able to share our analyses, our ideas around each of these different propositions. Next slide, please. Yeah, so I want to kick us off with a short video from the Public Policy Institute of California. And I thought that they did a really great job at laying out what we can expect from our voters here in California. So go ahead and play the video, please.
California, with its endless supply of blue skies, blue waves, and blue voters.
I think the blue state of California, blue state.
Blue California, lefty California.
Completely blue. California is a blue state.
Okay, so we know California today is a
Heavily blue state.
But this wasn't always the case. From 1952 to 1988, Republicans won the state in nearly every presidential election. A California native and U.S. senator,
Winning's a lot more fun.
as well as a California governor, even made it to the White House on the Republican ticket. But in recent decades, changes to the state's population, culture, and economy have transformed California and its electorate. So, who are the California voters of today? As of July 2024, over 80% of California's 26.9 million eligible adults were registered to vote. Democrats make up nearly half of registered voters, while Republicans account for around a quarter, down from a third 20 years ago. Independent or no-party preference voters account for about 1 in 5 registrants. While California is strongly Democratic overall, many parts of the state have a solid base of Republicans. Republicans represent more than half of registered voters in Lassen, Modoc, and Shasta counties, while counties like Butte and Kern have nearly equal shares of registered Republicans and registered Democrats. California is an incredibly diverse state, but does the electorate reflect this? Consider this. White Californians are 38% of the state's adult population, but account for half of likely voters. In contrast, Latinos are 36% of the state's adult population, but only about 1 in 4 likely voters. One factor shaping the state's electorate is that millions of adults are not citizens and therefore ineligible to vote. On top of being disproportionately white, California's likely voters are also older, homeowners, more educated and affluent, and U.S. born. This phenomenon has been dubbed the exclusive electorate, meaning that those who turn out to vote do not reflect the diversity of the state's population as a whole. Non-voters, on the other hand, are more likely to be younger, Latino, lower income, less educated, and renters. Independents make up larger shares of registrants than they did 20 years ago, and independent voters hold a variety of political views. Among independent likely voters, 38% lean Democratic and 24% lean Republican, while 38% either lean toward neither party or are unsure ideologically. More than half of independent likely voters are moderate. A state as large and diverse as California encompasses many people with differing political views. What's more, California's demographics continue to shift, with population growth slowing and increased racial and ethnic diversity. As California's population continues to change, demographic and other transformations may further alter the state's political landscape.
Great. Thank you for sharing that video. I think it's important to remind ourselves sort of the bigger picture here in California. And I thought that was a really great summary of who we're anticipating showing up to the voting booths. Part of some work that I did while I was policy director at Northern California Grantmakers was really thinking about what are the ways that we as individual civic participants can improve or strengthen our democracy, especially as it's been under threat for the last several years. So one way is obviously what we're talking about today, which is protecting free and fair voting processes for all voters. California has some of the most liberal, progressive voting capabilities for Californians. And so I'm hoping that we take advantage of free and fair elections by next Tuesday or mail-in ballots. Another part of this three-legged stool that we call it of democracy is redistricting. So promoting inclusive redistricting, which is our processes for all residents. This is where we draw out the specific voting blocks. And this is really important because how you design those voting blocks reflects what is most important. And I could already imagine that not all the data is going to be available quickly, so we have to be patient. But the second part, and this is why redistricting is important, is that we're going to be looking at swing states and looking at the specific voting blocks, whether they're going to turn blue or red. And a lot of that has to do with how those lines are drawn. And so that's why it's important here in California to participate in that. And lastly, the census, which is what feeds into the redistricting, is we have to support a full and complete census count of everyone in California. The last time we did this in 2020, there were several obstacles, including from the federal government, but COVID-19 definitely hurt this process, where it was a lot more difficult to be able to count everyone in California. And as a result, we lost representation at the federal level. And we also, that means we also lose resources when we need them. I would say that this is also just strengthened it when when we have an equity lens and we want to make sure that those without traditional voices have a say in this process, and also inclusion, making sure that there's language access as people participate in these different processes. Next slide, please. So a few takeaway messages that I think are important. So one is, especially in this election, we've heard a lot of misinformation and disinformation. And so making sure that we're able to cut through a lot of the white noise that we're hearing. Like I mentioned before, there's also polarized perspective and policy agendas. And then next, our democracy is at risk. I know that the former president has talked about you will only have to vote once and you'll never have to vote again, which, a lot of people fear that that is a lot more authoritarian, and that some adjustments will be made at the federal level to reinforce that idea. And so, one key takeaway that I hope that you learn throughout this session today is that have a plan, and especially around voting, not just for yourself, but your loved ones and your community. If you can help them, digest what are the different propositions for and what they do, or if your organization has a voter guide, please share that. If not, some of the organizations on today's call will also have voter guides, and we're happy to share those after this program. Next slide, please. So as I mentioned, propositions are also important. So we have several statewide propositions on the ballot. California is one of the few states that allows people to collect signatures to add propositions to the ballot. These, I will note, they can be confusing, as they can either be very specific to an industry or very general, making implementation difficult to imagine. So that's why I encourage people to do their homework, read the pros and the cons for each proposition, and do your homework to make the right voting decisions and share that generously with your loved ones. Next slide. So as I think about, and really why this is a call to action, is what is at risk for health equity moving forward? So, depending on how, or even regardless of how the election turns out, we're looking at, the ACA, the Affordable Care Act. Will that be a regress? Will it be expanded? Health for All efforts. So finally signing up our undocumented populations that before did not have access to insurance or coverage, or even those citizens that do have documentation. This is also about having options for them that they can afford. Our diverse health workforce, economic stability, medical expansion, the future of democracy, telehealth and broadband access, reproductive justice, GLBTQIA+ rights, justice involved population. So there is a lot at stake. Next slide, please. So, a couple of questions that I have is, how can we prepare our communities to vote for a more equitable future? And what can we do to be heard if we are not eligible to vote in this election? Next slide, please. So now we'll get onto the great panel conversation. I'm very lucky to be joined today by Kieran, Nanette, and Carolyn. And so I'm going to kick us off. Thank you again for joining the panel. In terms of health equity, what is at stake for California in the 2024 presidential election? Kieran, let's start off with you.
Oh, great. Well, thank you so much for having me here today. I'm with the California Pan-Ethnic Health Network, or CPEN. We are a statewide healthcare consumer advocacy organization, and I'm actually just standing in for my dear friend and colleague, Rhonda Smith, who's the executive director of the California Black Health Network, and I wish you could hear from her, but I will say there's a lot of great information on their website, which I think Shirley can drop in the chat for you to get a sense of the work that they're doing, as well as I do believe they have ballot recommendations up. So I'll put in that plug for Rhonda. So when we think about what's at stake, there's a sort of thought leader. His name is Daniel Dawes, and he talks a lot about the political determinants of health. So Crispin talked a little bit about the social determinants of health. But what Dr. Dawes points out is that upstream from the social determinants of health, right, are policy decisions, and policy decisions that are made by political actors, some of whom are elected, some of whom are not, right, but are really that what determines our health and what either advances or hinders health and racial equity is a political and policy determination, right? The fact that we live in red line neighborhoods didn't happen by accident, right? You know, all these kinds of things. These are I really appreciate his sort of thinking around this. These are the political determinants of health, right? And he sort of goes on to say, you know, the political determinants of health involve the systematic process of structuring relationships, of distributing resources, and administering power, right? And so that's what we think about a lot at CPEN. We think about what's at stake. I mean, everything's at stake in an election, right? It's the opportunity that we have as individuals, as participants in this democracy, right, to influence those political determinants of health, which again have this really outsized impact on the trajectory of our lives in our communities. To get just a little bit more specific, when we think about health and some of the things that are like top of the list on the table with this election, right? So there's really significant changes that would happen around health coverage and premium subsidies for folks who are enrolled in Covered California. Those will likely go away under one scenario. And as Crispin pointed out, it's not just the president. Congress is like really teetering on the line here, right? About whether we are advancing health and health equity and health reform, or whether we're going backwards. Medical debt is a huge issue that the Biden administration has really tackled that impacts 50% of all Californians with low incomes, right? That's an issue that's been tackled administratively, very much on the line, depending on what happens. For us at CPEN, we've focused a lot at shoring up the Affordable Care Act through non-discrimination protections, language access, all those kinds of things that are encapsulated in regulations to the Affordable Care Act, which the prior Trump administration already tried to roll back, right? So we know what's on that list, right? We sort of know what's coming. And I think, you know, as I said, everything is at stake in any election, but particularly in this election, for the reasons that Crispin laid out.
Great. Carolyn, do you want to go next? And then we'll tap Nanette.
Sure. So I really appreciate Karen's framing of that, because I think for us, as I think about the Asian American, Native Hawaiian, Pacific Islander community, right, that's the focus for Asian Pacific Fund. I think one of the things that people tend to think is that, you know, they're all, you know, we're all very well off, everyone's got coverage and all this. And I think there's just, through some of the gains that have been made over the past few years, we've been able to get more granular data to see that, you know, actually statewide uninsurance rate is 7%, but it's actually much higher for example, Korean Americans, right? No usual source of care. Again, we're seeing outliers in the Korean community, in the Vietnamese community. And so I think for us, we're really paying attention to definitely all of the things that Karen mentioned around, you know, losing coverage, affordability of care, right? Many Asian American, Native Hawaiian, Pacific Islander communities will delay care already because of cost. And so these are all things that we're definitely keeping an eye on. And of course, fears around public charge, right? Undocumented communities. Crispin, you mentioned the strides that have been made in California. That was super intentional work that started right way back, but more than 10 years ago. And so a lot of those gains are at stake. But I think for us, we're also very much paying attention to quality of care and benefits. So losing language access, losing culturally competent care, right? Things like losing diversity in the workforce. And I think in general, I would say one of the things that at APF we're really trying to support more is actually community-driven, community-based models of care, especially around mental health. And so is there going to be less funding for those types of interventions that really come from community? And, you know, at stake for us is really, are we going to lose our ability to define the care that works best for our communities?
Mm, love that. Thank you. Nanette, do you want to weigh in?
Yeah, weigh in. You agree more. This is a really dynamic panel, and I'm really grateful to be here. My name is Nanette Starr. I'm Choctaw from Oklahoma Nation on my father's side and Director of Policy for the California Consortium for Urban Indian Health. And Shirley also has our Voters Guide, which tries to remain neutral. So even if you hear me not remain neutral in my voice, our voter guide is supposed to be more neutral. I just have a couple things to add. I think you all really touched base on everything. And I actually was just recently turned on to The Political Determinants of Health, and what an amazing book it really adds to. There's a lot for us to unpack there, but I think one of the things that I really want to emphasize for adding is just equity in general. We've really had to work very hard, not just at the state of California, but for all of our organizations and representing all of our different communities. And it took a death, a murder, in order to bring equity to the forefront for us to be able to use the R word racism in typical groups. And that's something that I think is one of the biggest things that is on the line with this presidential election, because I think there could potentially be a backlash that sends us, I don't know, maybe 90s, 80s, maybe even further back. And for the American Indian and Alaska Native people that we support through the California Consortium for Urban Indian Health, this is already a huge challenge. Just being able to vote and bring your tribal ID card is a big challenge. And so everything that was mentioned, the Affordable Care Act, Medicaid, CHIP, all of these programs, some of our wins that I'll talk about a little bit later, housing stability, justice and labor rights, incarcerations, the GLBTQIA plus rights and inclusion that are even just on the California ballot. All of that I see could have potential negative consequences based on this election.
Great, thank you for that. And I know you just talked about changes that happen when people are in power. And so we saw a consequence of this just recently. So the Supreme Court changed with the appointment of several conservative justices. This action led to the rolling back of the protection set out in Roe versus Wade over 50 years ago, as well as the elimination of affirmative action programs. Can you share what implications these historic rulings could have on the communities that we all serve? Carolyn, this time I'll start with you.
Yeah, and I think for us, we've been thinking a lot about affirmative action. It's a very charged issue in the Asian American community. I was told, I took this job 2 years ago, and I was told there's two topics to avoid: gun control and affirmative action. And we've delved into both. But I think what's important to say about the affirmative action piece is that, it's been largely characterized as a college admissions issue, right? The June 2023 SCOTUS decision around Students for Fair Admissions versus Harvard and North Carolina, right? It basically said race-conscious affirmative action in college admissions is unconstitutional. So that in and of itself is problematic for a whole host of reasons, right? In terms of diversity in college campuses and for us in the health workforce, right? Eventually in terms of the diversity of the health workforce, which has a lot of impacts to communities of color. If we believe that cultural concordance, language concordance are important, right? Language access. And I think in this role at Asian Pacific Fund, we are a place-based, race-based organization. And so one of the things that we've realized through, as this has played out, is, I'm going to get political here, right? Like the folks that brought that SCOTUS case, they have a much bigger agenda, and they're not done with pushing that agenda, which is really attacking other programs that are also race conscious, right? Shutting down programs for that are intended to support specific ethnic groups. Hopefully folks have heard about the Fearless Foundation, right? The philanthropic arm of the Fearless Fund. They were essentially shut down for awarding $20,000 venture awards to Black women entrepreneurs. The same group went after the Smithsonian of all places, the National Museum of the American Latino, for an internship program that they were running to increase Latinx students' exposure to arts management programs, right? And so So this is something that it may not be so clear as to why it matters in the health sector, but in the health sector, we rely heavily on community-based organizations to partner with us, right, to ensure health equity. And those organizations, in addition to a DEI rollback, right, their funding is going down. But also now they have targets on their backs, potentially, of facing lawsuits for serving specific ethnic groups. And so that's something we've been paying a lot of attention to, and have partnered with the California Black Freedom Fund. They rolled out, it's called Lead for Racial Justice, but it's a legal education advocacy and defense program for nonprofits who are doing racial justice work, giving them training and access to legal support to really figure out how do they keep doing this work? How do they mitigate the risks that are now present in doing this work? So all of that, just, it's to say this is the context we're operating in now before next Tuesday, and things could get even worse, right?
No, and thank you for that. I think it makes a lot of sense. Like, you know, what is the point of pipeline programs if there's no beginning place to start to activate people to come and work in the community, to think about equity and how we build it in from the beginning. Nanette, do you want to go next?
Sure. I just have a couple things to add about that. And I'm also taking notes because I'm also learning a lot. So thank you so much, Carolyn, for sharing some of those organizations. So the implications for Supreme Court ruling for our American Indian Alaska Native communities, of course, also include going back to that health equity, but limiting opportunities for students as well as professionals as well. So not just the receiver of those health services, but those on the other end, those that are in an advocacy space. And I really wanted to just highlight the erosion of protections. And that's a huge, huge fear. So that rollback of protections means additional risk setting. So we're going to be getting a lot more risk. And that also means a lot more steps back in health equity. And then other policies, especially around the educational system, we're going to see it trickle through all different levels of the educational system. So it's not just like, sometimes I think I hear about when people especially talk about Roe versus Wade, they think about it in kind of a box, but it actually will trickle out through all different parts of areas that we have worked really hard to build up, especially in public health, but also in advocacy, also in law and policy. Thanks.
Absolutely. Absolutely. And we know, for example, that they're both based on the 14th Amendment. And so you also have GLBT rights in there with Roe versus Wade. Kieran, do you want to weigh in?
Yeah, and I think I kind of want to pick up on some of Carolyn's comments. So if we go back, and I'm not a lawyer, my dear friend Raul is on here, so he'll correct me if I get these things wrong. But you know, if we sort of go back in time a little bit with the Supreme Court, when we first sort of went down this journey of the Roberts Court, right? One of those early decisions was really about voting, right? It was about voting rights, and it was about racial equity, right? And it was about really, I think, eroding the Voting Rights Act, right? And I think that's really important to be sort of tracking of how we got to the affirmative action decision and how we're getting to other things. And that case, to my understanding, actually relied on our civil rights laws and turning them on their head and saying, we're going to use civil rights laws against people of color to take away the rights of people of color. And I think that it's a very intentional sort of move by the Supreme Court. And it's something that is, I think, deeply concerning and disturbing for people of color in this country, right? And that specific decision, as it relates to voting rights, has increased the gap, the voter turnout gap, right, between white folks and people of color. And particularly done that in counties. The way the decision worked, it particularly impacted some counties that have a really poor track record, right, on voting rights. And it's particularly increased that gap in those counties, right? So, you know, that is something that we now have to live with for now, and have to, I think, double down on our mobilization and our people power to counter that. The other thing I'll say is, as we sort of look at this trajectory of decisions from the Supreme Court and see sort of how they impact health, I think that, in California, we've lived with Proposition 209. We have somewhat of a good sense of what this looks like. But as Carolyn said, there's a very concerted litigation effort strategy, right, to go after some of our very specific health programs. I mean, folks might know about the Abundant Birth Project, right, that operates in the Bay Area. This is a program that gives a very small guaranteed income to pregnant women who are experiencing particular disparities, in part because of their race, right? And it is based on data, it is based on research, it's proven to work, right? And that's one of the programs that's been that's currently being litigated, right? And so I think sort of tracking that, this has really direct impacts. And, the Supreme Court is not something that gets changed quickly with this election, right? Like this is it's an institution that's supposed to be there for the long term. But I think, again, what's really important is from our perspective, right? While there's all these things that are very concerning, there is also hope, right? There is hope at the end of the day. And there is hope around what we can do around some of these decisions that are coming from courts. And the one thing that I'll add to that, and then I will hand it, I'll pass the mic, but is that there was a really, I thought, interesting, useful poll that was done some months ago that looked at DEI, right, which is such a third rail issue in some ways now. And everyone's like, no, we hate DEI, da 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 da. But when they broke it down and said, do you support, training people to be culturally competent in a workforce? And do you support this? Everybody said yes. And they said yes, even if they said, I don't think it benefits me, which is wrong. But lots of people think that, right? Like, even if they said, I don't think it benefits me, they still said, I support it. And so I say that to say, even though these things are happening, I believe that the majority of Americans and the majority of voters are with us, but we need to figure out how to close that gap.
Great, thank you for that. Nanette, this time I'm going to start with you. How are you educating and encouraging your community that you serve to vote, especially low propensity voters?
Yeah, we're doing quite a few things. So we actually have a small award through the California Native Vote Project, and it's not to get out the vote, which there's a lot of get out the vote dialogue that's happening, but this is about changing the narrative. So I'm gonna just run through a couple top things that we're doing regarding this project, and we're calling it Be Heard. And I think Shirley, you have that link. Otherwise, I'll put it in when I'm done. But one of the things is creating that trusted voter guide, and so that is the voter guide that I had mentioned at the very beginning, and wanting to make sure that this voter guide stays at a neutral place. And when I say neutral, and this is part of changing that narrative, we all vote according to some criteria. And whether it is something in your family, an issue you're dealing with right away, that you used to deal with, some other perspective. And so this voter guide, just so everyone knows, it does have an impact to AIAN communities. And that is the lens that we're looking at these propositions. So I'm not looking at, according to Nanette, this is what I want everyone to vote. And even Sukui, according to Sukui, it's looking at what's best for our communities overall in order to help improve health outcomes. So it is looking at that health outcome perspective. So that's one of the first things. So in that way, we're wanting to create trust with our voters guide, but also community engagement and accessibility. So seeing where those barriers are. So where those barriers and what areas can we work in order to help build that trust with community members. There's a lot of really great outreach that's happening right now that Sukui is involved in. There's always powwows almost every weekend across California. And so we definitely attend those and hear conversations from people to really understand what their perspectives are of reasons to vote or not to vote. And then going back to that narrative change, which kind of feeds into everything, is really being able to emphasize the historical context for our communities with voting. So noting that the historical barriers for our participation, despite the passage of the Indian Citizenship Act of 1924, specifically, it was the Voting Rights Act of 1965 before we started seeing our communities voting more. And so when we're talking about those really low rates of voting, thinking for our communities and sharing that historical context, like it wasn't very long ago that we couldn't even vote. So what does that mean? And so it's not like, oh, just vote. And I like the video about, you know, California maybe is turning a little purple, and I personally live in a purple county, but it's not just about voting for the federal elections, which I know there is the emphasis for this call, but we're really driving home the reason for your vote for local. So being able to address some of those current barriers, and local being state as well as county. And we would be happy as Sukui to help be a support for people that want to understand what I call the riddles, the propositions, because I've read so many different voter guidebooks and I still had to do extensive research. And I do this for a living. And I was still like, wait, what? What are you talking about? This sounds good, but then I dig deeper to find where the money goes or what issue it was the proposition is actually trying to solve. And it's not going to solve it, or it's a risk. And then you'll have to make that decision on your own about which risk you want to have. It's not like black and white. So really just understanding that our vote counts locally more than anything. And so us as Californians to be able to advocate for ourselves and those needs for our family as well as our communities through the right to vote. And I'll stop because I could keep going.
Great. Thank you, Nanette. You raised so many good points. And, you know, sometimes it's not just explaining what a yes would do versus what a no would do, but also looking at who's supporting it, who's opposing it. And that also adds color to your decision. Carolyn, do you want to go next?
Sure. So we, as a community foundation, we don't actually do a lot of direct action in terms of encouraging the community to vote, but we support a lot of partners who do. And I think one thing that I'll just flag is AAPI data, and API Vote. They did this great 2024 voter survey that they pushed out in July. That said, 90% of Asian American registered voters say that they're actually planning to vote for a president, Congress, other offices in November. So that's great. That's a little bit lower than from 2020 and 2016, but it's promising in terms of when we talk about low propensity, what is that really about? But I think the interesting part is less than half of them say that they've been contacted by any sort of major political parties, right? Only 42%. This was back in July. But still, like Democrat, Republican, they're just not reaching out to a lot of AA and HPI populations, which is probably a topic of a different webinar. But I think for us, the low propensity piece, what we're seeing, a lot of it is about language access, right? It's really about creating access to vote, to access for the information that's necessary to be able to vote and how to vote safely, right? And so because we do have a very high proportion of folks who speak another language other than English at home, right, or are limited English speaking, and so that's been a big issue. I would say one of the things that we did last month, I think it was, is we partnered with a group called API Council to do a mayoral town hall in San Francisco, where we actually supported the provision of simultaneous interpretation technology, right? And so that's great because they see the mayoral candidates, they're speaking directly to them. You have like aunties and uncles in the room, and they're able to engage directly, which I think is just super important. But I will say that for us, there's a couple partners that I would love to just mention who we support and fund. Chinese for Affirmative Action is one of them. They do some great work around mobilization of the community, but they have an effort called the Immigrant Parent Voting Collaborative that's actually in partnership with other communities of color, other organizations that, so it's multiracial, multi-ethnic, and it focuses on voters in San Francisco, especially non-citizen voters, right? Because in San Francisco, those voters were just allowed to vote in school board elections, right? And so they're working across this very diverse coalition to mobilize parents, make sure that they're aware of their voting rights, make sure that they can fully assess the risks of voting, right? Because folks who are non-citizens, obviously the fears are still very much there, and that they know what kind of protections that they can have access to vote safely in San Francisco. But our other organizations, APEN is another big one, Asian Pacific Environmental Network. So they do a lot of their outreach in 7 different languages. So a lot of the work that organizations do to reach these sort of low propensity voters is really about language access.
Great, thank you for that. Karen, do you want to weigh in?
Yeah, thanks. And also say for CPEN, we don't do sort of direct voter turnout. I will say, California is such a massive state that is very difficult to reach voters, right? And it's very difficult to reach voters without money, I guess is what I should say. And so for that reason, I think it makes the situation with statewide offices and ballot propositions that much sort of higher stakes, because it's very hard to get to communities with accurate information. And so that is one thing that we try to do, particularly on ballot initiatives, is say, you know what, you might be seeing all these $80 million worth of ads, just for example, but here's some other facts right here, and putting that information out, I think is really important. The other thing I'll say is, California has done so much in terms of making voting easier. And yet there's certainly people and communities who sort of say, well, I don't really see the point, right? Like it's all bad, or it's all not going in the direction I want it to go. And so, I'm not going to engage with it. And I think one of the things that we think about a lot is like, you can't mandate good candidates, right? Like you can change all the voting rules you want. You can't mandate good candidates. And so that's a challenge. But what we can do as advocates is really, I think, the leadership development work that all of our organizations do. Like, I'm so proud of the people who have gone through our programs at CPEN and are now running for office. Like, there's a few local elections in California that I'm so excited about, because these are people who came up through a lot of our organizations and programs and are going to go on to be the people making these decisions, right? So I think, just to say, I think a lot of the education is not only for election day, right? It's like, how do we build this pipeline? How do we get people excited about voting because they see themselves in the people that they're voting for?
Absolutely. That's such a great point. And, I will also say our responsibility doesn't end on voting day. It's also about co-governing, about, being there as a resource with that elected official and standing up for them as they unpack their platform. So speaking of, what we're hearing out there, so there's a lot of disinformation and misinformation around the election. What messages do you think need to cut through all of that rhetoric? Also, how do you think your communities are receiving these messages? I know I heard about, different languages, but, is there media to be able to promote these ideas of why it's important to go out and vote? So I'll start off with you, Carolyn. What messages do you think need to cut through all the different rhetoric that's out there right now? And how do you think your communities are receiving these messages?
Yeah, I think also a learning for myself over the past couple of years is there's a lot of fake news in the Asian American community, a lot. And so I think it's actually a little bit less about the specific messages, but the trusted messengers. And I think it's really about who are the partners who can reach communities where they are. Like Karen said, it's actually kind of hard, right? You have to be in community to know where they are and how to reach them and where they're at, just in terms of their knowledge and their thinking about voting. And so I think the voter guides are remarkably important in our communities. Again, because of the language access needs, you won't find a voter guide in less than like 7 languages amongst a lot of our partners, right? And so I think we're very fortunate in that, in terms of the infrastructure investments that have been made in organizations like API Force, and thank you, Shirley, for posting their voter guide, statewide, 10 languages, API Equity Alliance in LA, right? So they're statewide, but also LA specific. And you've heard me mention Chinese for Affirmative Action here in the Bay Area. Chinese Progressive Association is another one. I think the thing that's really, so there's almost somewhat of a triangulation that's needed, depending on your standpoint of looking at these different voter guides. But I think the other thing that I've seen a lot of our partners do, which I think is really smart, is understanding that in our culture, we have a lot of differences in the political viewpoints of our youth versus our elders, right? And not always the case, but a lot of our partners like APIA Vote they have a whole guide on dis and misinformation. And it's clearly written for youth, right? There's like zines and different formats, but it's meant to cultivate their ability to have these intergenerational conversations within their families, right? You talked about this in the beginning, Christine, right? Like, how do you help your family understand these issues? So I just think that's a really interesting approach, is reaching the youth with literally, how do you explain this to elders, and how do we give them the information that they need to have these intergenerational conversations?
Nanette, do you want to go next?
Sure. This is really informative. I'm glad that we're all having this discussion together. I think the main thing that I would add that we're doing as SACUI, a couple things, and the empowerment of the voters is one thing. So not trying to take that power away or say, I'm going to water it down and tell you yes or no, but to be able to encourage the asking of questions. And I really like, Carolyn, how you brought up the youth, because that's one of the things when we first started our Be Heard campaign, is we went out and talked to youth and said, what are you talking about with your friends? Like, do you guys vote or not vote? And it wasn't something we made it clear, it's like, it's not to judge them if they're voting or not, but it's just to hear what they're saying and why they don't want to. And using that kind of information to be able to provide that narrative shift, that narrative change, and address it head on, because it's real, right? So encouraging the asking of questions. If you don't understand, or you feel like there's a representative who isn't clear, ask them, send letters to them. We definitely are encouraging folks reach out to their representatives. They're there for you. And I think there's also a link that I provided you, Shirley, to help get in touch with your representatives as well. And this is a perfect time to do that. Also sharing the purpose for some of those propositions, for example, like, we wanted to frame it in a way that we're talking about what the proposition's trying to solve, not just these different organizations that are in a battle for all different reasons. And so I understand looking at who supports and who doesn't, but sometimes it's not actually about what's on the proposition. There's politics that happen behind the scenes with those organizations. So it's not even about the proposition. So we really want to make sure that voters feel that encouragement and empowered to think about what is the main problem that made this proposition get on the ballot. And then I think probably the last thing is just really keeping our messaging specific to our American Indian and Alaska Native communities. And that's why we have the impact. Like, I'm not trying to tell everybody how to vote. I'm saying what some of those impacts can be for our communities when we're sharing that information and hearing back from them those questions that they have. So it's going back to what you said, Kieran, like, California is huge, let alone all the different diverse groups of people, right? But what can we do to help support our community in this very questioning time?
Thank you. And I will say, your voter guide is beautiful. And I think it also just reflects the culture of the people that you want to engage with it, right? Kieran, do you want to jump in?
Yeah, so two things on disinformation, misinformation. So one is sort of the decline of the news media and journalism, which I think is really an issue for all of us to reckon with. The fact that Jeff Bezos owns a newspaper is a huge problem for democracy, right? And so it's really limiting actually where people can get information, because there is less sort of journalism out there, right? And so people are seeking other sources of information, and that makes sense, but it is really difficult for people then to be expected to sort of sort through these things. The other thing that I think is really concerning for us right now is the very intentional strategy, I think, to use messaging, to use misinformation, to split and divide communities of color. And that's always been an issue. That's what CPEN was founded on, right? It's how do we bring these communities together? But I think we see more and more of that. And, as an Asian American voter, I get mailers from, some of these conservative groups telling me like, oh, affirmative action is such a big problem, right? All year. I don't just get them at election time. I get them all year, right? Like, this is this is a very concerted effort. And I think that's a really big responsibility that everybody here has, is to push back, is to bring our communities together, is to help people understand some of this is not true. All of this is not true. And we are stronger together, and let's not be pitted against each other in this way.
Great. So beyond electing our next president, we see several propositions on the ballot. For example, Proposition 35, which would use managed care tax to support the safety net in delivering care. That's one, but I'm curious if any of you have any external guidance. We've already kind of talked about this, or to better understand the preparation. We've talked about voter guides. Is there anything else that you would share? Are you doing webinars or town halls or anything like that to engage voters more directly? If the answer is no, it's okay. We could skip over to our last question.
We do have one more thing. I'll just jump right in.
Yeah.
This is Annette for those that are just listening. So we do have fireside chat. So we have some podcasts that we're doing with that Be Heard program. And we're chatting with different folks, some elected officials, and hearing some great discussions about their view of voting and over time how it's changed, and bringing in that focus of the narrative change, not just to get out the vote. And I guess the other part that I wanted to add is that this program, just like what you have been sharing, Crispin, isn't just for right now. Like, yes, we're highlighting this right now, but we're going to be using this program throughout the entire year to help keep that civic engagement going. And so we're definitely going to continue to we release right now. It's a bi-weekly blog, but it will go to a monthly blog, really talking about that civic engagement. And there's things that come up all year round that are really important. And so staying kind of apprised of what all that information is as we're moving forward can make it easier to know what you want to advocate to be on the ballot, or when something is on the ballot, you will have followed that along the way.
Yeah, no, that's great. And, when I mentioned the three-legged stool, those processes are open for everyone to come and draw the voting blocks, to think about the census and how they get everyone counted. Kieran or Carolyn, do you want to weigh in?
Well, I'll just make one note about ballot propositions.
Yeah.
So, it's great that we have this form of direct democracy in California, but I think that it's really important for voters to understand sort of what goes into a ballot initiative. And this goes back to, this is a huge state. It takes a lot of money to reach voters in the state of California, right? It's different than my local city council, where you could go door to door and reach everyone in the town, at least where I live, right? It's a huge state. And so I think a lot of what we see with ballot initiatives, unfortunately, is really wealthy interests, deep-pocketed interests, who have the money to put something on the ballot that maybe they couldn't get through the legislature, they couldn't get in the budget, or they want to undo, right? We've seen this, like we've seen there be an attempt at a referendum on stopping oil drilling next to schools, right? Like things like that. And so I just think it's important for voters to understand that that is sort of, unfortunately, the context of ballot initiatives in the state of California. And that is one lens with which I think people should really scrutinize these different issues, including Proposition 35.
No, that's a great point. And, I'll also mention there's a lot of external money from outside of California that goes into supporting those propositions, getting them on the ballot. Yeah, it's a lot of outside money. Carolyn, any last note that you want? Okay, so now we have our magic wand question to wrap up this plenary, and then we'll see if there's any questions in the Q&A. What is one core message we want our audience to take away from this conversation? Nanette, I'll start with you.
Summing it up to one message, huh? Okay.
One message.
Okay, it has two parts. It's 1A and 1B. But really it's that every vote is a stand for health equity. And so even when I hear some of my friends and family feeling overwhelmed by not sure which direction to go by not voting, that is not standing for health equity. So we are wanting to vote in order to make that stance. And that's why I think my main point is to drive home is the impact you can have on those local results. So it makes a difference at the state as well as the county. And just like Kieran was saying about how there's big money behind things that are on the propositions, but that doesn't mean that us as community can't get things on there. We just oftentimes don't. And then we wonder why are all those things on the ballot? Because those that had money and time went and did it, and we're busy working over here. So thinking about that, and this is part of, I guess I'm really plugging the civic engagement. Maybe that's my big overarching umbrella, is to be involved and learn how to be involved. And so we definitely at SCUI on our website, we definitely have links about how to contact your local representatives. We're going to be launching over this next year templates. So if there's an issue that you're interested in, how to send those, how to contact, how to provide that relationship building between your electeds, because they're there to work for you. They're really good at getting elected, but a lot of all of you, all the listeners, all of us in our individual different fields, we're specialists in that field. And so for us to help, like if I'm a construction worker, for me to inform my local representative about things that impact the construction field, for example, I wouldn't expect that elected to know about the construction field. They know about how to get elected. So keeping that in mind as a context, and that's why we need that democracy, because we all come from all different parts and we need to work together. Thank you.
Great, thank you, Nanette. Kieran, do you want to go next?
Sure. So I'll just say I was very grateful, excited to see sort of your opening, Crispin, and sort of how ITUP is leaning into equity. And I'll just say for us at CPEN, equity is fundamentally about power, right? It's about who has power, who doesn't have power, and how we change that, right? How we redistribute power. And voting is one essential way that we exercise our power. And I do want to say, though, voting is not the only way, right? To your three-legged stool, and there's also many other ways. And I think this is particularly important in communities we work in, where not everybody has the right to vote, which doesn't mean that your needs are less important, doesn't mean that your voice should be less equal, right? And so there are many different ways to participate in democracy, whether or not you have the right to vote. And so I think that is how we will achieve equity, right? By sort of taking that power and making our voices heard. And we don't have to agree on everything. There's certainly issues on this ballot where I talk to my friends and family. It's like, oh, I don't know if I agree, right? But the important thing is that we show up.
Yeah, absolutely. Carolyn, any last core message you want the audience to take away?
Yeah, and I'm gonna respond from the perspective of a funder and also as a health funder in my past life. And I think really the tagline being to collaborate in order to be there for our communities, because I think as we think about health equity, like everything's hanging on Tuesday, but honestly, we're not going to know what the results are of the election for potentially some time, right? And I think if we center our communities, there's going to be anxiety, there's going to be fear, right? And so support for things like Know Your Rights, right? And supporting organizations that play that role. They never stopped doing that work. They're going to need to continue to do that work. And for our community-based organizations that are trusted by communities, right? For the funders and systems leaders who are on this call, we talk a lot about, well, for funders specifically, about giving those organizations general operating funding, right? Because they are going to have to play so many different roles in these really the first 100 days of this administration. And so, and they have to be in tight relationship with systems, right? To be able to relay what's going on in community and what community needs. And so I think really the health sector, now that I'm out of it, I feel like I see is so good at collaborating and so fortunate to have groups like ITUP, like SCUI, like CPEN, right? Working with them. And so to just lean on that, because there are things that we think are just going to happen, but they've been needs all along. They're just going to be amplified and it's not going to be so clear cut.
Well, thank you, all of you, Nanette, Kieran, Carolyn, for engaging in this conversation and helping the communities that we serve better understand why it's important to go out and vote, and the context in which we're all doing it. So thank you so much. And I will invite Raul to join me as we reflect on this panel. I didn't see any questions in the Q&A. I don't see any, so we're gonna go ahead and move on. Raul, what are your initial reflections about what you heard in the panel?
Thanks, Crispine. And that panel was that was fantastic. I think they said a lot of the things that maybe I would say. So I'm glad. I was really glad to hear that conversation. I thought the panel did a great job of pointing out of thinking about health. Not just narrowly as like going to your healthcare provider, but about all the ways our health can be impacted. I was thinking about how voting, I'm just in the coming election, how we're voting on who represents us and how that's going to impact our health, these important ballot initiatives at the state and local level. And people are voting on things like housing locally or environmental issues. And then, there's these other connections with health too that we see that where there are people, I've seen research looking at places where voting is easiest and democracy is thriving, that you see better health outcomes for people, better indicators of health, and that there's even connections just between the acts of voting and civic engagement and health. But really just heard a lot of intersections with the work we're doing on leadership development and language accessibility, racial solidarity, intergenerational work. We'd been convening a coalition for the last several years that last year was pushing a bill, AB 884, that made it to the governor, that was aiming to expand language access coverage for elections, and both services and then language access coverage. And a lot of our laws around language services are state laws. They're more than 40 years old. They're outdated. They're not serving the needs of our voters, especially our immigrant voters. And unfortunately, the governor vetoed that bill, but they're thinking of bringing that back. And so I'd encourage people to look up and see how they might support that effort next year. And then just one other thing, I guess just a source of frustration is hearing that conversation about these court decisions, because it reminds me that we have 3 Supreme Court justices that were appointed by the last president, who lost the popular vote by millions of votes. And it's a reminder to me that especially in a presidential year, that of the Electoral College and the role it plays, and that I think sometimes we lose the fact, we think of it as this like quirk of our Constitution or something, but it's not. This is a structure that was put in to empower Southern slave states who were worried about Northern free states outnumbering them in voters, and building this compromise that said that relied on congressional apportionment for in the Electoral College, and Southern states had more representation there because of the 3/5 compromise, and so we're stuck with it. And so, well, I shouldn't say that we're not stuck with it, but it's a reminder too, right, that democracy in America is far from perfect, and that the story of American democracy is fighting and striving and pushing for more fairness and more inclusion and more equity. And we get the democracy that we work for, and so that's why we need to go out and work and vote. And so that was just another thought that came to me.
Yeah, and I'm curious, what did we learn from the election of 2020 that we should keep in mind as we go out and vote? I felt like the voting process itself was okay, but it was really that transition of power that was very disruptive and violent. But yeah, is there anything that we learned from 2020?
Well, the transition of power was not smooth. Obviously, I think the guardrails in our democracy did hold up, but just by a thread. It was not. Things were very close, and I think we also, I just talked about how there were even in 2020, Biden won by 7 million votes. But if you look at the states of, Georgia, Arizona, and Wisconsin, which could have flipped the election, they were decided by something like 66,000 votes combined. I mean, that's how close the election really was when you look at the Electoral College, and that's what it could be again. And, we've seen since 2020 a vast exodus of experienced election officials who just said, I'm done with this. This is just too much. The threats, the violence, and it's not worth it. And so we've lost a lot of great public servants, and we're going to see how that holds up. We lost a lot of great ones here in California, and that makes me really nervous. And then, our elections in California are not. We talked about making a plan to vote, and I encourage everyone to talk to your family, your friends, your neighbors, your community about making a plan to vote. Our systems in California have gone through a lot of change. It's not. And, good changes that to try to make things easier to vote. Everyone's getting a vote by mail ballot this year, but, we have a system of voting in California where half the counties vote under a system called the Voters' Choice Act, and the other half are using the old neighborhood polling site model. And so it's not intuitive. You might be in a media market for a county that's a vote center county and hearing about voting, and that's not your system. And so, it's a reminder to look up the rules, but very quickly in a vote center county, you can vote at any of these locations, any vote center. There's far fewer of them. And if you're in a traditional polling place county, then you're assigned to a polling place and you need to go there. And then I would just remind folks too that the registration deadline is passed, but you can still register to vote at any vote center, at any polling place. And you can still vote. And I saw a link in that was put here about where's my ballot, but I would encourage everyone, if you haven't signed up, to sign up to track your ballot. If you're mailing your ballot, you can find out if it's been received and accepted. This is one of the great positive changes in our laws. You can find out when it arrives, when it's been processed, and make sure it's been accepted. And then one of the reasons it takes a while to count votes in California is because we have a lot of voting by mail, and we give voters a lot of opportunities to make sure their votes are counted. And so when your vote has to be postmarked by Election Day, but if it arrives late, it gets, after Election Day, it can still be counted as long as it's postmarked on Election Day. And if there are things like a missing signature, or for some reason you mixed up your partner's ballot and your envelope, there are ways to fix this, and your election officials will contact you up to 2 days before certification. And so this is a good thing that it takes a while. We chose accuracy and inclusion over just speed, and I think that's we've come down in that was the right choice for the state.
Great. No, thank you, Raul, for sharing your thoughts. I think it is so critically important that all of us feel safe, whether it's voting by mail, dropping off the ballots at a box, which is what I'm doing right after this call for myself, my parents. And, it's still scary. We're seeing what's happening in Oregon, in Washington, with people burning the ballot boxes. I really try to go to places that I feel are secure, like City Hall, that tend to have security guards to just protect the ballots.
Yeah,
But
and another great opportunity for people who want to vote in person, it's an opportunity to get language services. It's an opportunity for people with disabilities to get accessible voting equipment. And so that's another really important reason that we make in-person voting widely available.
yeah, no, thank you for that reminder. I think that's a great asset. So before we close out, any last comments or things, Kieran, it looks like you want to say something. So I want to make sure
No, I have nothing to add.
I'll open the floor. Okay, well, Nanette, Kieran, Raul, thank you so much. And Carolyn, I know she had to jump off, but thank you all for participating today and for helping inform the communities that we serve. I think it requires not just one person or one organization to promote health equity. It takes all of us, and we're all stronger together. So I appreciate you and thank you so much. And to the audience, make a plan, get out there and vote. So thank you so much, and we'll see you next time.
Thank you.
There's a plug for our conference, which is in a couple of on February 3rd and 4th in Sacramento. Next slide, you could register using the QR code, and thank you so much for joining, and you'll have an evaluation to complete. Thank you, everyone.